This panel is made up of Kevin Urso from Connected Technologies, Ed Probst of Vanguard, and David Goldstein of Certilman. I'm here to kind of function as both a moderator and to answer questions. This is really a session where we've got absolutely nothing planned, which is actually how I live my life. But if anybody has questions that they want to kind of throw in here, we'd be happy to kind of answer the questions that people have. I know there's the first question kind of thrown out here. Do you have any insight on the SBA EIDL loan in regards to the SBA, subordinating to an existing bank debt? The SBA is supposed to subordinate to existing bank debt. That is what's supposed to happen. That doesn't mean that you don't need to talk to your bank, especially if there are covenants and stuff attached to the loans that you have. Again, something that you should look at, but they are supposed to subordinate to existing bank debt. That's kind of part of the SBA concept. What will be the impact on the real estate industry as companies find out that their staff can work effectively at home? Anybody want to? I know none of us are real estate experts, but anybody want to kind of dive in on that one?
I know I've been wondering about my office space when I'm paying the bill and it's sitting here empty, for sure.
Yeah, I think that as we move to the new norm, I'm gonna actually throw out a question to all of you guys. Ed, I'll start with you. Looking at the space that you're occupying now and looking at what your plans were a year ago in terms of either expanding your space or staying pat or what, I mean, how has your thought process changed from, where you were a year ago to where you are now, and your thought process on kind of operating a virtual office going forward?
Yeah, so it's a great question. And it's actually very appropriate for us because we just entered a lease 2 years ago. So our plans were we leased enough space to accommodate where we were from a capacity of employees now, and where we thought we would be 7 years from now, which is the end of our lease. And I can definitely say that after, we transitioned our office, I believe it was March 12th. We transitioned our office to a virtual environment. Everybody was working remotely from home. We virtually had, 2 years prior to that, we converted everything. We were pretty much paperless. Everybody had remote access to their systems. Our phone systems are remote. All of our CRM and client management systems were in the cloud. So it was a very seamless transition. I think, from a perspective, everybody's got a different perspective on this and an outlook on it. From my perspective, I can see that, if our lease was up next year, we probably would not be taking additional space, and we would probably considering having some of our employees work remotely permanently. If you ask my partner that question, he is more of a person that likes to be in the office, and he likes having that space to go. So I think he would probably answer the question differently. But we are certainly considering more remote options in the future for our employees, and we've already proven that we can do it. And from our client's perspective, I hear it. I've been hearing it more and more, that that commercial real estate question. I've heard several of our clients have already told us that they've converted their entire workforce to remote. Maybe they're getting close to a lease end or something like to that nature. And some have even gone to half and half. So I think that everybody has learned how to operate remotely in a more efficient way. How that impacts the commercial real estate, I mean, I get asked about how the health insurance market's going to be impacted by this all the time. And it's really anybody's guess. I mean, obviously, it looks like, you would think that there would be a tremendous impact to the health insurance market from a rating perspective because all the claims. But then on the other side of the coin, for 3 months, nobody's been using preventive care or elective surgeries. So how the commercial market is going to be impacted, I wish I had a crystal ball, I could tell you, but I do know that more people are going to be choosing and selecting more remote options.
David, do you have any insight?
Yeah, I do. What I've heard from a number of clients, it's kind of interesting. It has opened a lot of eyes in terms of how we can function remotely and how efficiently we can function remotely. That being said, a number of clients have communicated to me that there's some space between their staff's perception of how efficiently things are working remotely and management's perception. And there isn't the same level of comfort with, well, we can do all this remotely from management's perspective in a number of instances. So that's just something, to kind of keep an eye on. For sure, it's been eye-opening, how much can be accomplished remotely. But I think in a lot of instances, aside from, Ed, you mentioned how individuals have different comfort levels, for sure. But just from a management perspective, notwithstanding the benefit of not having to occupy as much space, I think the jury's out somewhat on how permanently, remote functioning is going to work.
Kevin, you actually are in the IT world, so what are you seeing in terms of your client base kind of operating a little more remotely than than in the past? And then I'll kind of chime in with my thoughts.
Yeah, I think we're seeing a mix. So we're seeing, a lot of people realize they can do a lot of their work remotely, but they also realize that sometimes there's something missing there too. Some things get done a little bit more efficiently face to face. I know I realize that in my business as well. We primarily have always worked remotely, but having that mix every once in a while, getting face to face with my technicians, things tend to get done a little quicker that way too. So I think we're going to see a mix going forward. A lot of mobile.
Yeah, I was going to say, I think the new generation, the millennials, they were looking for more flexibility in the workforce anyway. And I think we were going to get to a more flexible workforce somewhere down the road. I just think the COVID pandemic kind of sped up the process of how that happened. And I think there is going to be, from a commercial real estate, I think there's going to be a redeployment of assets. I think, when you look at office space, I don't think there's going to be as much of a need for office space. There's going to be definitely a greater level of need for warehouse space and things like that. So I think you're going to see, and retail is not going to be, I think, as big. So I think there'll be a redeployment of resources within the real estate marketplace. It's just kind of my thought in the process. A question for you guys. What do you see the greatest challenges that the nonprofit sector will face as we move forward into this kind of new normal, whatever, or new abnormal, as I think Glenn is calling it? What do you see as kind of the greatest challenges? And Kevin, if we can start with you, and maybe each of you can kind of keep it within the realm of, like Kevin, IT, David, legal, and Ed, healthcare and benefits. So Kevin, why don't you start?
Sure. So I think nonprofits, I think, have always struggled with doing cybersecurity anyway. So I think now with everyone being remote, it's even making it worse. So I think one of the biggest challenges is being able to secure those remote users in an effective manner. It's going to be something that we need to, and that was during our session, we tried to spell out a couple, like the top 10 things you need to do.
Okay. And so you think that that's really going to be, what other issues are you seeing? You have the whole cybersecurity component, which you kind of discussed, but are you seeing now that more and more organizations are looking at cloud-based type platforms and moving more from more to an online version of the software that they're using, and you're seeing more integration of software, those types of things in the workforce today?
Yeah, I see them using online, Microsoft services, AWS, Amazon. Some companies can't. Some companies have these applications that they use internally that aren't ready to go cloud-based. So there's going to be a mix. Some companies are going to be able to go to the cloud easily and transition. Others need to do this mixed environment where it's a kind of a hybrid. They have some of the stuff still in the office, some of it remote. And that actually makes it a little bit more difficult to secure and manage.
Okay. David, What do you see from a legal perspective as some of the greatest challenges that the sector is going to need to grapple with?
So first, I'd mention, which isn't really purely legal, but certainly is practical and front and center on everyone's radar screen, the impact to fundraising, because so many fundraising events have been canceled, and nonprofits now are in a place where they need to completely reimagine a fundraising modus operandi that has taken years or decades to fine tune for a particular nonprofit, and now they need to reimagine that. So clients that have enormously successful fundraising events that are annual events ongoing for many years, those events are not doable right now, and may not be doable for some time in the future in a way that participants are comfortable. So reimagining that is a big challenge. And on a legal level, something that actually had a call about this from an accountant last week who has a client that started a great new program to respond to pandemic-related needs by addressing food insecurity in the community. Problem is that that activity is not within their permissible corporate purposes under their certificate of incorporation. So that very adaptive and healthy and necessary desire to respond to the needs that we see as nonprofits can sometimes get us into trouble unless we keep an eye on the underlying legal piece of it, and that's sometimes hard to do when we're balancing all the things that nonprofits have to balance. Now, there are ways to deal with that, specifically amending your certificate of incorporation, but that's you need to be focused on that at the same time as you're jumping in to meet the community needs, because you can't do one without the other, at least legally.
Yeah, I think that's an important consideration. I've had a few people who've reached out to me and say, I want to make a difference from the pandemic perspective. I want to kind of help out and everything else. But if it's not in their mission and it's not a part of their legal allowed services, that creates all sorts of problems. And I think what you're finding is, organizations are very intent on making a difference and helping, and sometimes they just get themselves in trouble.
Right. They act, and that's healthy, and ask questions later, but you need to ask the questions first so that you can act in a way that protects the organization and the board as well.
Ed, how about you? What are you seeing in terms of HR and benefits and, kind of the new normal with respect to being able to work in a remote environment or whatever?
Yeah, so I think for one, I think nonprofits are going to have to, something that you said before with millennials and understanding who their employees are and what employees are looking for from a recruiting standpoint is important. And, there may be more millennial type or employees in general that's part of their job description that they're looking for, is they want to work in a remote world. They want flexibility. As you said before, that is definitely happening and has been trending that way. We walk into clients now that employers that have very different type of work environments where they're more family oriented, they're more relaxed environments. We have clients we walk into, they have pool tables and ping pong tables and dogs walking around. So I think recognizing the fact that this can be added to what employers are looking for is important. Also, from a budgeting perspective, we are getting a lot of questions related to, especially this time of year, what should they expect in health insurance premiums going forward? And that's a big thing. And as I said before, it's really anybody's guess. But that if the market is impacted severely by this, it could increase costs dramatically in a community rate market where under 100 employees, where you really have very little control over your rates from a wellness and health perspective, claims perspective, but also in the large group market or even the self-insured market. I think there's going to be more of a need for nonprofits to strategize, think out of the box, get involved in wellness initiatives or education for their employees to help them get involved with claims mitigation, understanding transparency in the marketplace where the cost of care is at the lowest cost, and using things like telehealth and prescription drug tools that can help them get more affordable options this way. I think there's going to be more of a collaborative effort in the industry between employers and employees, trying to budget and forecast for what could be a dramatic increase in rates if this does not tend to subside soon.
You think there's going to be more self-direction within healthcare, where employees are going to have more of a say in terms of what they do, where they go, and what the benefit packages need to look like?
Yeah, I mean, it's been going that way, trending that way for a while, and that is one way that employers can be creative. Multiple options, multiple tiers of options, having employees make consumer-directed choices on their healthcare, in our opinion, drives down costs long-term. We've been advising our clients on that for many years. It helps with, from a budgeting perspective, helps make more creative contribution strategies where everybody wins. The employer can control costs. The employees can pick plans and select options that are sufficient for their own needs and prudent financially. So I think it was going that way already. This will create more of a need just to help trend those claims in the right direction. Again, nothing like that can happen overnight, but if employees are using plans that are more suitable for them, and everybody is in a position where they are transparent with where they're getting their MRI or their CAT scan from, or using prescription drugs, generics, or using urgent care over emergency, and telehealth now, which will become a huge part of the way care is directed. That's education on these kind of components is going to be critical in driving down costs in the future.
Yeah, I mean, I kind of agree with what everybody said. I mean, David, I totally agree with the fact that nonprofit organizations are going to have to move a little more virtual in terms of their fundraising aspects. And I think going forward, even if we get back to some sort of newer normal and we get back to a point where people can congregate and come together, I think nonprofit organizations should incorporate some level of virtual component to everything they do, whether it's incorporated into the event that's a in-person event, or whether they keep some level of one or multiple virtual events on their calendar on a ongoing basis. I think that's going to be very effective for the sector. Kevin, I agree wholeheartedly that technology is going to be the wave of what we need to do in terms of ensuring that we run more efficiently and we're able to handle the virtual office environment, which means that software needs to be able to speak to each other, and that we're in a situation where we have higher levels of integration within the software. I think the sector needs to find alternative ways and be more creative in how it does business. I mean, you got to realize that, nonprofits are very social oriented and they're dealing with people face to face. And, how do we now, kind of, as Ed, you mentioned, kind of convert that to, other ways of service delivery and be there as a resource. And then I think also from a fiscal perspective, we don't know what revenue streams are going to look like. We don't know where money's going to come from. We don't know what sort of government cuts are going to take place. We know that they're going to happen, but we don't know when or what or how deep. And I think nonprofit organizations, when they go through their budgeting process, they need to create budgets. And when they create those budgets, they need to have layers within those budgets where they have like 5% cuts, 10% cuts, 15% cuts. So all of that stuff is all predetermined, that if there are drops in their revenue streams, they know where the low-hanging fruit is, and they can make those cuts at the time that they're happening, so that they can almost respond instantaneously, because all of the decisions have been made up front, and they don't have to go back to the board and get pre-approval from the board for an amended budget and stuff. So I think, organizations need to really start looking at how this whole thing has impacted them fiscally, make sure they understand, what the potential ramifications moving forward are, and start developing budgets and stuff that kind of consider, what those cuts may look like and what those cuts could potentially be from an expense perspective and a staff perspective. I know that's difficult because it's impacting people's lives, but you have to make those tough decisions that are going to keep the organization moving forward. David, go Go ahead.
Yeah, before we leave this subject, if I could amplify something that you said earlier, and I said too, in terms of permissible corporate activities, and everyone bear with me because it's sort of like a corporate geeky kind of and governance geek kind of comment, but it's drilling down one extra level just to avoid a place where people tend to get confused. So activities that you engage in that are necessary and helpful to needs that you identify, it's not enough for those to match your mission statement. It's the purposes in your certificate of incorporation. So even if you've got a mission statement that works in terms of these new activities, even if that mission statement is in your bylaws, that's not enough. The document that counts is your certificate of incorporation. So that's the piece on a governance level that you need to make sure works with your expanded activity.
David, there's a question here posted for you.
Okay.
It says, David, in my new life, I'm now an HOA board member. Our attorney is advising to stick to CDC guidelines to mitigate liability. Also, we took out a legal rep policy since carriers aren't covering COVID-19 claims. Any thoughts?
So, this is one of those areas that is changing and developing. And it's something that our clients that are HOAs, we are advising them to sit down with us, their lawyers, and their insurance brokers, and kind of see what they need to do to meet their needs and protect themselves. And it's a very fluid situation. And the critical step, I think, that the questioner has already taken is identifying the exposure and the problem. And so now really it's a question of your team and your insurance team seeing what can be done to meet those needs.
Okay. There's a question here for me. Do you know what kind of proof would be acceptable to prove loss of revenue if applying for the HHS Medicaid funding? Comparative profit and loss from 19 to 20, would that be sufficient? You can definitely do a comparative. It's not profit and loss because you're looking at loss of revenue. So you look at your revenue levels in 19 versus your revenue levels in 20. The other thing you can do, according to the frequently asked questions that are part of that HHS, is you can look at your original budget for 2020 and compare your actual operations to your original budget. And if you're experiencing a decline from your original budget, that also would be sufficient to prove the loss of revenue, which is one of the first steps in determining the use of the funds and be able to get those funds in essence to be a grant. So from a what are you guys seeing out there, or what do you guys see in terms of the nonprofit sector, in terms of the need for increased collaboration and potentially maybe merger and acquisition happening within, or consolidation happening within the industry? As there are cutbacks in government funding. There are, it's harder to raise money through, because events aren't happening. So Ed, why don't we start with you? What do you see in terms of, or where do you see the industry going from a collaboration / partnering / whatever?
Yeah, I mean, I think, again, it was starting to trend that way already. And every organization is going to be different, but this is definitely going to speed up that curve. I know for a fact of some clients that are already, that were already in process of partnering with larger organizations from a perspective of sharing resources like HR resources. That was a big one. Recruiting, where they could benefit from using the tools and technology and the people from larger organizations. I think from a perspective of fundraising, that was that was already happening to a degree, but now in a perspective of organizations are trying to figure out right now if they're going to host their events, are they going to convert them to online based events? And I think that there's definitely can be some benefit from organizations partnering at first from a fundraising perspective to see if they can match, on just a joint venture when it comes to events and partnering on technology and things of that nature. But then it could lead to much more. Again, I'll go back from a budgeting perspective, as you said, with Medicaid cuts and cuts generally from state and local governments, they're going to be looking for more resources, and smaller organizations might benefit from collaborating in the Medicaid world specifically with larger type organizations. So I think you'll start to see more of that.
And I think that's definitely going to happen on the managed care front, where, as we move more and more, and I think, the government cutbacks are going to push to a faster movement towards managed care. And I think, as you get more and more into managed care, you're going to need to have that collaboration. You're going to need to have the organizations coming together. Kevin, what are you seeing in terms of, organizations starting to work together, maybe from a back office function and things like that?
Yeah, we've been seeing that. That's been a trend for a little while now. I think a lot of the cloud technologies, it makes it much simpler for different organizations to kind of join up and use one unified platform, where maybe in the past everyone had their own unique system. So I think things like this webinar tool that we're using today, it makes it a lot easier for a smaller organization to host an event that maybe they couldn't in the past. Only a larger group could. But yeah, the unified systems, I think, make it a lot easier for different organizations to join up.
David, you have any insight into what you're seeing? I mean, you're as an attorney, you're on the front line in terms of some of the communications that are taking place. Are you starting to see an uptick in those types of conversations and agreements and everything else?
Absolutely. I'm not sure if we're quite advanced enough to where we're seeing a lot of the agreements and transactions actually happening, but the conversations are definitely starting to build, in fact, to build up to a crescendo. And so there too, there's the legal and the governance component. So what organizations that pursue a merger find, and it's often a surprise for them, is how strong the governance component is. The fact that there are internal approvals. So if you've got a membership, of course, the membership has to approve in addition to the board. But most significantly, regulatory approval, if Attorney General approval, and that's a process that takes time, and it's not at all a rubber stamp. There needs to be a very strong compatibility, not just culturally, and that's always something to look at, is the culture of the two organizations, but legally, and from the perspective that we were talking earlier in terms of our permissible activities, there needs to be a compatibility there, and the use of the assets of each organization after the merger is something that the Attorney General looks very, very carefully at, because the Attorney General's primary perspective is always to make sure that assets that were acquired for a particular purpose are used for that purpose. So if in the course of the merger, the direction or the programs of the organization are going to change and evolve, the Attorney General will have a concern with that and will want to know that assets that were acquired for specific purposes are going to continue to be used for those purposes. So that means what that translates into in terms of practicality is a longer and more involved process of merger than most people realize. So it's good to kind of build that into your planning, that there's a lot that has to happen, and it's not just internal in the two organizations, it's on the regulatory level as well.
Yeah, and there's something you said, and I think it's important to kind of bring out, when organizations are coming together in whatever fashion they're coming together, whether it be a sharing of a fundraising event like Ed that you brought up, or Kevin, kind of sharing cloud-based technology or whatever it is, there should be some sort of formal agreement that gets put in place with all of these types of arrangements, so that I think a lot of times, nonprofits take a lot of things on faith. And they kind of just start working together. And I think, there just needs to be better documentation sometimes of some of that, those documents or some of those relationships.
Absolutely.
What are some of the creative things that you're seeing organizations doing out there? Again, we've been, for the last 3 months, we've been kind of trapped inside and not really been able to get together as and deliver services the way we've traditionally delivered services. Have you seen stuff? I mean, I don't know how close you guys are to the boots on the ground, but have you seen stuff where organizations have kind of jumped out there and have done some stuff that's kind of surprising to you, that you kind of look at and say, wow, that's kind of a cool idea, and that maybe some other organizations kind of learn from? Who wants to go first?
Well, one thing that I've seen, and maybe it's not exactly on the boots on the ground programmatic level, and I certainly have seen an effort to respond to the needs that that organizations see. But I'm seeing a very practical effort to double down on ways that the nonprofit can engage its constituency, be it people who receive services, funders, board, even at the board member level. I see much more significant traffic in terms of emails, in terms of virtual meetings. So there's a real effort to enhance the engagement, understanding that it's very difficult to compensate and make up for the loss of the face-to-face, person-to-person contact at events and meetings. So there's even a greater emphasis on more frequent virtual communications, and I'm definitely seeing that, and I think that that's necessary and healthy.
Yeah, one of the cool things, I was talking to a nonprofit agency last week, I think it was, and they're a domestic violence organization. And if you think about it, as a domestic violence organization, they're working with individuals who maybe have been, trapped in a home with the person who's been abusing them for a period of time. And what they're looking to do and what they've been trying to do is they've been trying to set up little kiosks in the community with computers and everything else where individuals can go and instead of, because you can't have those face-to-face meetings, but instead of trying to provide or kind of tap into a meeting from their home, which they really don't have the privacy and ability to do, they set up these kiosks where an individual can travel to the kiosk and get FaceTime like this with the counselor and be able to have communication with a counselor with a computer and everything all set up so that, they can have the interaction that they need and get the help and assistance they need where, they just don't have the ability to do it now because they're kind of trapped in a house for a period of time. So I think that was kind of cool. And I think, there's probably a lot of other examples of things like that. Kevin, you wanted to say something?
Well, not that I have a specific example, but we're getting a lot of requests for help to kind of, so I know the people are thinking about this type of thing. So we'll get, how do I set up a webinar? How do we do these type of things remotely? How do I run an online class? So we're getting a lot of those type of how-to questions. So I think the ideas are probably out there and they're trying to put it together.
I think they need to do what we do. We just make it up as we go along.
Right.
So Ed, any thoughts in terms of what you're seeing out there that might be a little more creative or ways that people are, even from your industry, when you're thinking about, HR and stuff like that, you've got to be onboarding and outboarding. Is that the correct phrase? Outboarding people?
Onboarding, yeah.
What?
Onboarding, yeah.
Yeah, well, that's coming on. But what about when you let someone go? Is that outboarding?
I guess we could call it offboarding.
Offboarding, okay. So in terms of on and offboarding, I mean, what are people doing that's different? How are they educating their staff and communicating with their staff from a virtual perspective? And I think that's something that both you and Kevin can kind of dive into. But Ed, why don't you start?
Yeah, I mean, I was going to say, I mean, what we're seeing now is, I mean, the use of technology is definitely at an all-time high from an employee benefits perspective. One thing I was going to say was about, I mentioned telehealth before and the importance of telehealth, and we're starting to see that in the direct care space, where the use of telehealth for, overtaking patients to the emergency room has become very important, and I think that that's been heightened since this started. From an employee transactional standpoint, yeah, I mean, even our firm, we've taken this time to increase our technology and our offer to our clients because they were asking for more technology when it comes to onboarding employees, managing day-to-day transactions, connectivity with insurance companies, streamlining that process so it is more efficient. And I think that they are what we're hearing from many nonprofits. I was on an advisory board for one nonprofit, and that was specifically what they were talking about on one of our last committee calls was was basically this was an eye-opening experience for them on how far behind they were in technology from a perspective of having employees work remotely, having information in the cloud to access, and then from an employee benefits perspective as well, the ability that to stop using paper so much and start using technology to create efficiencies within the employee benefit cycle.
Yeah, I think that's been one of the greatest challenges in the nonprofit sector, is the fact that the nonprofit sector hasn't really invested in the technology and infrastructure that it needs. And I think, part of it is, this whole, Executive Order 38, which was kind of put in place 6 or 7 years ago, which kind of limited the amount of administrative spending that, organizations do. And, to sit here and say that, organizations can't use government money to more than 15% for administration is a little ridiculous. When in order for organizations to kind of move forward effectively, they need to invest, and they need to invest in infrastructure, and they need to invest in technology, and they need to invest in, all of these capabilities, which they just didn't have the ability to do. And now when we move to a need to be more virtual, they're a little behind where the other businesses are. And I think you're right, Ed, in terms of, just not having the ability to kind of function as effectively as quickly, and the fact that they don't necessarily pay their staff as much as some of the other businesses out there. Some of the staff don't have the ability and technology at home to kind of handle this. Kevin, what are you seeing in terms of the technology in the sector and where some of the gaps are?
Yeah, so some organizations we see, they've invested some money to provide proper security, but now once you went remote, a lot of that's changed. So now we're going back to them and saying, well, you have this, we need to adjust it now because now half your staff is working remote. It's a different scenario. So we're asking them to invest again, which I think is challenging. The simple one is, all of a sudden everyone needed a laptop or a desktop at home. A lot of them didn't have them, so they were trying to use their personal laptops or trying to use their iPads to get on and do their work. So that was a big challenge. And, and our recommendation is to say, buy them a organization laptop, but that's not always an option for them.
And I'm sure that created a whole bunch of issues with cybersecurity and everything else.
Yeah, definitely. Now you got to worry about how is their home network set up? Who else is on the network? Is that network compromised? Because that's the entry point into the organization's network and data.
And I mean, I don't know whether you know the answer to this question, but I mean, what impact does that have on the ability for an organization to get cybersecurity insurance? What does that impact on premiums of cybersecurity insurance or any of those types of things?
Yeah, so the insurance is a tough one. A lot of those policies are written in a way that if you're not doing some basic steps, that policy is not going to, it's not going to help you, because if you don't have a valid backup, if you don't have antivirus and malware protection properly configured, that's an item in that policy that says you have to have that or we won't cover you. So all of a sudden you've moved beyond the wall you used to have of security, and you don't have any of that stuff in place anymore. So it definitely, you would need to review those policies.
Okay. David, anything you want to add with respect to the technology and the nonprofit sector?
Yeah, I think the issue that we were just discussing is really critical. Maybe the unseen transition to a place where perhaps on a practical level, cybersecurity is a real issue, and the protections you had in place have now been circumvented because people are using their home networks, and then B, in a way that is not visible to anybody, you've also stepped outside of the parameters of your insurance coverage, and so you're paying for coverage, but on a significant level don't have it. And so that's I think that this is one of those sort of lagging issues that is only going to be more, and I'm glad we're talking about it because it's the kind of thing that very often goes under the radar until you start having some significant exposures and claims and situations. And then for those people who have been victimized, it's too late. So I think that that's a real, you know, it's tough if you think about all that we've spoken about already just in this one panel. There's an awful lot on your plate if you're a nonprofit in the midst of this pandemic, not to mention that we're all people experiencing issues and concerns with our own safety and our family's safety. And so, you know, now you're dealing with programmatic issues, you're dealing with cybersecurity issues. It's an awful lot, and I think that this cybersecurity piece is something that is very amenable to getting lost in the equation. So I think the task for boards as part of their oversight function is to identify these things and put them front and center so that they don't come back to bite us later.
Remember, guys, if anybody has any questions, please ask. I know we've got a few minutes left in this session, but this is your opportunity to ask the panel questions. While we're waiting to see if anybody has any other questions, I got another one for you guys. You know, what do you see as the top 3 takeaways that the nonprofit sector needs to take away from today? And it could be something that you discussed during your session or whatever, but what are the 3 things that the nonprofit sector needs to kind of consider, you know, the 3 top things for the people who are listening right now? So Ed, we'll start with you.
So one, I mean, as employees are assumedly, for those non-essential employers, are transitioning back to work right now, I think it's important for nonprofits to have a strategy in place on how to get them back to work if they are bringing them back into an office environment right away. Having a clear plan, having some flexibility in thought process, knowing that every employee is going to be different. Some employees will be eager to get back to a workplace. Some will be cautiously optimistic about going back, and others won't want to come back at all due to anxieties or fears that might be existent because they either had a sick family member, they themselves were sick. All of that needs to be factored into the employer's thought process. I think from an employee benefits perspective, the time is now to try to implement as much efficiencies in your workflow, and also be more creative in your plan designs and your strategies going forward, assuming that there's going to be budgetary constraints that are non-employee benefit related, but then increased costs that could occur due to everything that's been occurred over the last 3 months. So I think those are definitely 2 things to consider. And then also, we talked a little bit in our session before that a lot of this flexibility from a perspective of the government and what they're allowing in changes within the employee benefit plans, whether that be relaxed flexible spending account regulations or things that have given some flexibility in the COBRA regulations, things of that nature, could create more compliance scrutiny later down the line. And it's important that you make sure that if carriers are allowing flexibility and changes, if the government has made changes to FSA or COBRA or things of that nature, make sure that these are consistent with your policies and your internal procedures that are in your handbooks and summary plan descriptions to make sure that you're not creating any compliance issues.
Document.
Yep.
Make sure the document is proper. Yep. Kevin, what about you? What are your takeaways?
So I think the most important thing would be training. So specifically cybersecurity training, with the staff being remote, you need to put them through at a minimum like an annual training, and that really should be a training that has constant updates to it. I think second is policies. So you need to have some written policies in place. You know, where is the data going? What's the process when people save their work? Is it getting saved on the laptop? Is it getting saved in the cloud system? What is your policy to make that happen? And I think you really need to have an audit or some type of assessment done on your systems. Someone to come in and take a high level look at it and figure out where are your risks, what's easy to fix. You know, lots of times there's 2 or 3 things you can just fix real easily if you knew about it. I think those are the 3 big takeaways.
All right, David, why don't you bring us home? We've got like a couple minutes left.
Good. And I'm going to piggyback a little on what Kevin said, because risk assessment is part of what he's talking about in a very practical and impactful way. And risk assessment is part of the oversight responsibility that a board has under the law. That's part of your fiduciary duty as a director. So that risk assessment includes not just the things that hit us in the face today, like how are we going to function virtually, how are we going to conduct fundraisers, what's going to happen to our budget and our funding. We need to go to that second tier of issues, and that's really part of what risk assessment has to encompass. And part of how we can do that as a board is using committees as resources to help focus on some of that offline and then bring it back to the board in a larger way. So risk assessment, I think, is one of my primary takeaways from today. Another is that governance matters. That governance matters and process matters, and that's really what governance is process. And I think it's critical, and I think this is a point I tried to make in my presentation earlier during my session, was that there's no dispensation at all really on the board level to lighten up governance or lighten up process or take any shortcuts. Zero. There's no leeway allowed for difficult times, and so that's part of risk assessment. And really, the board needs to multitask and keep its eye not on all of these programmatic and financial matters alone, but also on the decision-making process and the oversight and the risk assessment, understanding that the rules in terms of process are as stringent as they were before the pandemic, and we need to comply with them if we're going to protect both the organization and the individual board members.
Thank you. So I think we're out of time. So look, guys, you guys were amazing. This was very insightful. We appreciate your time on this. And if everybody who's still with us, if you can, guys, just jump over to the last room so I can say my goodbyes, I'd appreciate it. Take care, everyone.
Thank you.
See you guys in the other room.
Thanks, everybody.
Thanks, guys.
Bye.
This was different. It was interesting. It's the first time doing this thing virtually. I do personally like the in-person version of this a whole lot better, because I get to see you guys, I get to hang out with you guys, I get to talk to you guys, as opposed to right now where I feel like I'm talking at you guys. Having said that, hopefully you all enjoyed the conference. Hopefully you got information out of this. I think overall it was fairly successful. We tried to answer all the questions that people have. If people do have ongoing questions or have any additional information they want, please feel free to reach out to us. I want to thank all of our speakers today. I think everybody did an amazing job. And we couldn't have been as successful if not for the speakers. We've also sent everybody the evaluation forms, and I know Christina just posted the evaluation form again in the chat. So it's sitting right there. If people can please take the time to fill out the evaluation form, complete it. We want to know what worked, what didn't work. I know there were some questions and issues with the speed networking that we did, but if people can kind of go through that, it's very important. It'll help us to really understand what we need to do for future events that we're going to be doing virtually. Also, this is going to be the same platform, as I mentioned earlier, that we're going to be using for the Imagine Awards. So we want to make sure that if people had issues with it, we want to understand what those issues are so that we can make sure that when we get to the Imagine Awards, things will be cleaner and work more effectively. For those of you who have not already signed up, the Imagine Awards are July 8th, a little over a week away. Please take the time to sign up. We're going to have the same speed networking at the beginning of the Imagine Awards, and at the end of it, you'll get to see the winners announced live as part of the event. We're going to be using the same Excel event platform, so you guys are all experts in it because you've had to work with it all day. I know today has been a kind of a bit of a long day, and thank you guys for sticking with us throughout the whole thing. We really appreciate it. Again, we're here to help you. We're here to be a resource to you. Thank you very much. And I guess that's a wrap. So thanks everyone for participating. Give us your feedback, and we'll be seeing you along the way. Thanks everyone. Take care. Bye.